The U.S. Bureau of Labor Statistics has deemed workplace violence in healthcare, quote, an important public health issue and a growing concern. I'm Lee Zurich.
And I'm Tisha Powell. A Bureau report found attacks against medical professionals increased over the last decade. And in 2018, healthcare workers were 5 times more likely to experience workplace violence than employees in other industries.
Since the pandemic, some lawmakers warn the problem has intensified and contributed to staffing shortages.
Here's an in-depth look at what's being done to protect those who are trying to save lives.
Hi, silly lady.
Mila Lindrews says she fulfilled 2 of her dreams, becoming a mom
Oh, it's the best.
and becoming a nurse.
I love it. I love being a nurse, and I love helping people.
But in 2022, while 32 weeks pregnant and working at a hospital in Vermont, both of those dreams were impacted, all in an instant.
She just kind of suddenly lost it and launched herself up and across the room and tackled me. And I went backwards over a stretcher that was behind me.
Lindrews says a patient who did not want to be discharged lunged at her and punched her in the stomach.
And I had these 2 crystal clear back-to-back thoughts of the nursery is not finished and this isn't worth it. This job, this woman isn't worth it.
Both mother and baby are healthy, but those moments of fear are hard for her to forget.
This was my job that I had chosen, and I put her in danger trying to take care of sick people.
Our entire department was shaken up about that for a while.
Sheena Fisher, a director at the hospital, says Lindrews isn't the only employee in the ER who's been assaulted.
She's just one example of many. It's happening a lot more frequent than anyone knows.
The Bureau of Labor Statistics reports from 2011 to 2018, the rate of injuries from violent attacks against medical professionals grew by 63%. And hospital directors say they noticed aggression towards staff escalated during the COVID-19 pandemic. In 2020 and 2021, healthcare and social service workers accounted for nearly 80% of all non-fatal injuries due to workplace violence.
I can't speak to exactly why that's happening, but I can definitely validate that the last 2 years we've seen an increase in violence.
According to Press Ganey, an organization that runs healthcare surveys, in 2022, 2 nurses were assaulted every hour. Nationwide, that's about 57 assaults per day.
Patient on-staff violence is impacting the overall workforce, and some of our nurses are actually changing their professions, questioning their purpose as a nurse.
At a hospital in Topeka, Kansas, Chris Biesing wasn't a doctor or nurse when he was attacked, but was in a management role.
As I was walking down the hall, there was a person that had been sitting on a bench, and he stood up and he attacked me and punched me in the jaw and drug me around the corner.
Biesing missed 2 months of work and spent 2 years recovering.
Broke my jaw, which led to 2 surgeries.
Biesing returned to work in a new role, Director of Workplace Safety, and he admits he still thinks about the attack.
I'll see someone walking down the hall and will wonder, do I need to protect myself?
But he's used those thoughts to help make improvements. The hospital doubled its security staff, placed metal detectors in the ER, and added notations on charts for patients with a history of aggressive behavior.
And the idea is to protect staff members so that they know there's a potential for violence there, but also to help ensure that they have the tools that they can take care of themselves and also make sure that the patient's safe as well.
Biesing has also advocated for tougher punishment for those who are aggressive towards healthcare workers. And in 2023, he stood next to the governor of Kansas as she signed a bill into law that increases penalties for assault on healthcare workers and makes it a crime to interfere with healthcare services.
It's not a solution, but it's one of the pieces that's going to help fix the puzzle and help protect healthcare workers more than we have in the past.
While penalties vary by state, protection is being discussed on a federal level. In September of 2023, the Safety from Violence for Healthcare Employees Act was introduced. Dubbed the SAVE Act, it would criminalize the intentional assault on hospital staff, similar to a protection that is already in place for airline employees.
Healthcare workers, in the effort to take care of the patient, put themselves in harm's way at times. And so what we need to do is take extra steps to help protect them.
Back in Vermont, opponents of tougher punishments say it wouldn't help. They say people causing trouble in emergency rooms are not thinking about the repercussions.
It's usually people in distress, so those are not the people who are going to be deterred by what is on the books, because if they would be, they'd already be deterred.
Defender General for the state, Matt Valerio, says an effective solution would focus on prevention rather than punishment.
I think we have to ultimately get at the root cause of what causes people to be in despair and what causes them to be a danger to themselves and others.
Even though the risk persists, there are healthcare workers like Chris Biesing and Maya Lindrews who return to the job while working through their trauma.
I see her and I can't imagine my life without her. And I'm sorry. It's just, she had been my dream.
According to Press Ganey, in 2022, the highest number of assaults against nurses occurred in psychiatric units, emergency departments, and pediatric units, while obstetrics and neonatal intensive care units reported the lowest number of assaults. By the end of 2023, nearly 40 states had laws in place to increase penalties for violence against healthcare workers.